Hello, this is Dr. Prajnanika, focused on your fertility health, and today we are going to talk about blastocyst and how important it is for your IVF cycle. Blastocyst is a stage the embryo reaches 5 to 6 days after fertilization. You can say that blastocyst is the last stage that the embryo is growing independently without any tether to the mother. And after this, it will usually implant inside the uterus and start growing into a baby. Blastocyst culture is a type of procedure which we are doing in IVF cycles, and here we are growing the embryos up to 5 to 6 days after fertilization. This is done in special incubators, tri-gas incubators, and in special culture media. Once the blastocyst is formed, this is the last stage. It can be cultured in lab. After this, we have to transfer the blastocyst for implantation. Blastocyst culture in many centers is a part of a regular IVF cycle. There are many benefits of blastocyst culture and it is known to improve your IVF success rates. However, in centers who are practicing both early stage embryo transfers as well as blastocyst transfers, it might not be a part of IVF cycle but may be considered as an additional procedure. There is a steady decline of embryos as the embryo is growing. For example, if we are retrieving 10 to 12 eggs, out of that 8 to 10 eggs will be good. Maybe we will get about 7 to 8 embryos, but up till the blastocyst stage, usually the blastulation rate is about 40 to 60%. That means we will be having about 3 to 4 blastocysts. So there is a steady decline. So usually we do counsel the patients, and there is also a risk that the embryos which are growing may not grow up to the blastocyst stage. There can be some arrest. So depending upon the number of embryos, many patients may not opt for blastocyst culture. Usually because of the special techniques which are used, blastocyst transfer has an additional cost. So financially also many patients may not be ready to go for that procedure. For these reasons, sometimes blastocyst culture is regarded as an additional procedure because it is a choice whether you want to go for an early stage embryo transfer or a blastocyst transfer. Even though there is a tendency to go mostly for a blastocyst transfer in all cases. It is a recommendation. We cannot say it is a necessity, because if I tell that if you don't do a blastocyst transfer you will not conceive, that is wrong. But yes, you can have a higher chance of conceiving, then it is a recommendation that you go for it. The benefits, if you want to know, is once the embryo is growing up to the blastocyst, we know that the embryo is competent. It is growing properly. We are seeing the rate at which the embryo is growing. And also you have to know that the embryos which are being formed, all are not chromosomally normal. If an embryo has grown up to a blastocyst stage, that embryo is more competent and maybe genetically also more competent. Secondly, if there are multiple embryos, we don't know which embryo has the most chance of transfer. So suppose there are 6 embryos, and now which embryo will you transfer? But if you grow up till the blastocyst stage, the embryos which are growing properly up till the blastocyst stage, these embryos will give you the maximum chance of transfer. So there is a selection advantage. The higher success rates we see with a blastocyst transfer is due to the selection advantage, the selection of more competent embryos. The success of a blastocyst culture will depend upon the quality of the blasts and whether the blastocysts have been formed or not. So this again depends upon 3 things. First is the quality of the egg. Secondly, the quality of the sperm. Generally, a good quality egg with a good genetic component will grow up to a blastocyst. Likewise, you can say that if the sperm is good, it does not have any DNA damage, then also it will give good blasts. Many times we have seen sperms that are abnormal or they have DNA damage, due to which we have abnormal blastocyst formation, and many a times the embryos might not grow up to a blastocyst stage, which we commonly term it as arrest. That means the embryos are not growing up to the blastocyst stage. This can also be due to a sperm factor. And thirdly, which is most important, that is the lab conditions and the culture conditions. If there is a problem with lab conditions or with the culture conditions, these also might affect the success rates of blastocyst transfer. Earlier there were criteria regarding the number of embryos to be transferred. However, with transfer of multiple embryos, the major risk is risk of multiple pregnancy. So in majority we are doing a single embryo transfer, but in a clinical practice sometimes we are going for transfer of 2 embryos, and these are the reasons where we might go for 2 embryo transfer. First, if the age of the woman is more than 40 years. Secondly, if she is having multiple previous failed cycles. And thirdly, if there is a concern regarding the quality of the embryo, that you feel that a 2 embryo transfer will give her more chance of success rate. That said, it is still our moral duty to explain to the patient that she runs the risk of having a twin pregnancy and the associated complications with the twin pregnancy. And the choice should always be given to the woman that whether she wants to opt for a double embryo transfer or a single embryo transfer. Blastocyst culture and transfer are generally not very costly procedures. The costs which is incurred are due to the use of additional culture media as well as the special trigas incubators, and is usually less than 1/10 to 1/15 of your IVF cycle. This is Dr. Prajnanika, focused on your fertility health. For more such content, please like and subscribe to the channel.